Welcome to our latest update on the situation regarding the novel coronavirus. We are again coming to you live from our London Assistance Centre, so you may hear the phone ringing in the background, which are calls coming in from our members to our team of experts as well, who are dealing with situations around the world. I'm joined by Dr. Mark Parrish, who will help us navigate the current situation in regards to the novel coronavirus. So, Mark, really, where do we start? We start with, what is the current situation right now?
Thanks, James. Current situation as of today, about 40,000 cases reported, of which 75% of those are in Hubei province in China, and a very small percentage, like 200 or so, are outside China. So the majority of cases in China, and the majority of those in Hubei. About 900 deaths, so we are still at about 2–2.5% mortality. Again, the majority of those cases in China, in Hubei, some in other provinces. Other things that we have seen, none of this what's called community transmission of the virus, so it's outside Hubei. Community transmission, which is where you and I might contact it if we are in a public place, and that means that the virus is becoming much more infective. That's certainly been happening in Hubei and in Wuhan, nowhere outside, and that's good because that means it's much more likely that the spread is under control. Quarantine regulations still in force in Hubei and Wuhan. That's probably made a significant difference to the spread of this disease. It's now about 2 weeks or so since this quarantine was started. We know that the incubation period of the virus is up to about 14 days. And so now, if that quarantine has been successful and if the incubation period is accurate, which we think it is, the next week will be really interesting because it will show us whether the quarantine has meant that case numbers gradually start to tail off. If you look at the graph today of cases, you actually can see that slight plateauing out. I think it's a little bit too early to say whether that has been effective. So let's wait for another week or so and just see what happens with that graph. The interesting thing is, the other thing that we found is that this has become, of course, much more than just a medical or a health issue. I mean, we've seen many countries instigate border screening and border security things, haven't we? And that, of course, organizations need to be aware of that, don't they, when they're thinking about travel and employees either in China or elsewhere around the world.
Absolutely, and I think that's something we're seeing with calls from our members and from organizations we're supporting, is very much that this is broadening out into a broader global mobility situation as well. How do organizations maintain business continuity, particularly in the immediate region, but also how do they ensure the safety of their employees and their traveling population as much as anything? And I think one of the challenges that we're helping organizations to face, and we're seeing organizations to face, is around keeping up to date with those travel restrictions, the changing alert levels, the changing government advisories that we're seeing with countries around the world. So the important aspects there are making sure they get the daily fact checks. The daily fact checked information, corroborated, it's clarified, it's confirmed as well, and to make sure that they use that in daily communications to their employees as well. Making sure that their employees are aware and educated on some of the restrictions in place as well, particularly where there are implications around quarantines or other restrictions on people being able to move freely between countries as well. As we've seen over the last week with the likes of Hong Kong and now Singapore, with increasing alert levels in those countries, that will have a knock-on impact in terms of being able to travel there and travel around from there effectively as well. So making sure that there's communication and that there is that daily corroboration of fact-checked information as well to align with that. And I think that will also tie in with the broader elements of supply chain management, business continuity as well, all aspects as well that organizations are considering and need to continue looking at when it comes to that. I think that also ties in with probably one of the biggest challenges that organizations are facing is what's still to come. And you highlighted as well about some of the data leading towards some plateauing of cases, but I think we're still in this period of a very fluid situation. So from your perspective, Mark, what are some of the changes we're likely to see in the next week or so? And what, probably more importantly, are some of the unknowns as well?
Yeah, certainly from a medical perspective, there's still a few unknowns. We know a lot more about that virus than we did a month ago. We know that generally the mortality rate at 2% affects the older and the younger population, but the thing about medicine is it's never particularly black and white. And so we saw over the weekend, a younger death from one of the doctors who initially noticed this outbreak in China, and I think he was in his 40s. So we have to be aware of that. We know that it's been well contained. We haven't seen any community transmission. That's likely to continue, but we still don't know enough about how the virus is spread. There was a theory last week that you could be infectious when you didn't have symptoms. I think that has been discounted now. When they went back into the research around that particular case in Germany, they discovered that the lady in fact had symptoms when she was in Germany. That's the Chinese lady, so we know that. There's a few other unknowns that we don't know, and that's a lot of those are around how governments will react and how public health organizations will react, and that links that back, I think, to businesses and organizations which will all have plans in place for managing outbreaks. Now is a good time to be checking those, to be rehearsing those, to be making sure that they are specific for coronavirus, because there are a few changes with coronavirus compared to maybe other disease outbreaks at work, such as TB or other viruses. Now is a good time just to check those in case this continues to be a problem, and that will help with business continuity in the next few weeks.
Excellent. Dr. Mark, in terms of what you talked about the unknowns and the importance of planning and preparedness, what are some of the other considerations that organisations should be taking into account right now?
I think one of the things that we should remember, this is a new outbreak. It's been around for 6-8 weeks so far. We don't know much about it. We know more than we did. It's killed maybe 900 people. We have to put that into context with other diseases which we know a lot about. Measles killed 126,000 people last year, and there is a vaccination for that. Malaria kills 400,000 people every year, completely preventable. But we don't know as much about coronavirus, so we should be aware. We should also be aware that the healthcare aspects of this is not just affecting people who may or may not have coronavirus, but what organisations should be looking at is the healthcare and the support to their staff in and around China, because what we are finding as an organisation is it is becoming a little bit more difficult for us to provide that healthcare in China, or to move people out of the country somewhere else if necessary, even if they don't have a coronavirus case, purely because of those restrictions and the less air travel. And that's another thing I think that businesses need to think about in their planning and have as a part of their outbreak testing and their outbreak exercising, so they can work that in as well.
Okay, excellent. So many thanks to Dr. Mark for his insight. For more information on how we can support you in your outbreak planning and preparedness, please don't hesitate to contact us.